Hello, welcome to Surgical Instruments, and we're going to focus on CSPD. Last week, we followed Johnny through the different departments of the hospital during his surgical procedure stay. Today, we are going to take a closer look at the Central Sterile Processing and Distribution Department and how it relates to the surgery department. All surgical procedures require the use of surgical instrumentation. Scalpels, scissors, retractors, these have all been used since the beginning of surgery. As we discussed in Module 1, to avoid surgical site infections, all surgical instruments have to be sterilized, which means all microorganisms, good and bad, must be killed from the instrument. This is where CSPD comes in. All instrumentation is sterilized in CSPD, and sterile supplies all come in through CSPD. So they're a huge, important partner in the OR. So remember last week, we discussed this unrestricted area of CSPD locker room, and this is where you come in street clothes and change into the hospital-issued scrubs and cap and shoe covers. And then we have CSPD, which would be this entire department, is semi-restricted. Okay, so picture that yellow area. That means that we need that this attire right here, the scrubs and the cap, to enter CSPD. Now, our decontamination area, you're going to see another layer of personal protective equipment, or PPE. We come in contact in decontamination with a lot of different microbes. Those microbes can also be dangerous to us. So it's important that we wear that PPE in decontam anytime we're dealing with bloody or instrumentation that has been contaminated or dirty. We want to make sure that we're wearing the correct gear to keep ourselves safe. Okay, so we mentioned that CSPD has this semi-restricted area, but we're divided into these two main areas that are kept separate by an actual wall here. And then this area is our clean area, and it's divided into kind of three different sections. We have packaging or assembly and packaging, sterilization and distribution or storage, and then we have decontamination. So we have these four different areas. Now, after surgical procedures, so the surgeries are done in these individual rooms here. Okay, so let's say a surgical procedure is done here. The surgical tech brings the dirty instruments into the surgical decontam. Now, these instruments are dirty, so they're not going to go back into that clean space. They're going to go into the outer hallway, which does not contain sterile supplies. It goes around the outer hallway and into surgical decontam, where they're left there. Those dirty instruments are left there. Now, our CSPD staff, wearing that personal protective equipment, will take the instruments and clean them or decontaminate the instruments. This is kind of like washing dishes by hand. After the instruments are cleaned by hand, they're then placed into a mechanical sterile washer. This is very similar to like a dishwasher. It would lie along the wall between the decontamination and this clean area. After the instruments are mechanically washed and dried, staff working in the packaging and sterilization area can grab the instruments from the other side. So it really keeps those clean and dirty areas separate, which is going to be a running theme throughout this entire course, and your entire career actually is keeping clean separate from dirty. Having that washer sterilizer that has two, has where we can load it and decontam and unload it in packaging, allows us to not enter and to have limited time in that decontamination or dirty room. The clean instruments are then assembled into trays according to different procedures, and then they are packaged, as you see here. They can be packaged in this paper material or plastic, it actually is material, or it can be in a metal container as well. They're then placed into a steam sterilizer that you see right here. The instruments go through a steam cycle that must hit a certain time, pressure, and temperature in order to kill all microorganisms and sterilize the items. After sterilization, the instruments are then stored on open shelving until they are picked and placed on case carts for surgical procedures within the operating room. These filled case carts will be brought, there'll be doors that are enter into the surgery department. The case carts will be brought into the inner core, where they'll all be lined up in this area, ready for the surgery department and for their procedures for the following day. The inner core and all individual OR rooms are restricted. In these areas, staff must wear hospital-issued surgical scrubs, hair cover, shoe covers, and a surgical mask. OR staff will take that filled case cart that was completed by sterile processing, bring it into their room, complete their surgical procedure, and then staff will bring the dirty instruments through the outer hallway and back into the surgical decontamination room, right where we started. I don't know if you can tell, but we have a circular pattern, don't we? Okay, it comes into the inner core, into a room, it's dirtied, it's brought out to the outer hall, it's covered as it's brought through this outer hall, and then it's brought into surgical decontam. And then that procedure that starts all over again. It gets cleaned again, it gets packaged and sterilized and stored, and so on and so forth. Okay, now it's real important that you remember this flow, and that you are never going to take one of these clean trays and bring it back into decontam. This decontamination area is dirty. It has the microbes and microorganisms from hundreds of patients, okay? We don't turn over this space, we don't clean it. We clean it, but it is not a space that is sterilized, okay? So we want to consider this area dirty and be very cautious with it. Do not bring clean items into a dirty area. It's important to remember that every movement within the surgical department is intentional to reduce or eliminate microbes. There are hundreds of ways that microbes could enter a patient through the fault of CSPD or improper surgical instrument handling. Every time you handle an instrument, it's important you think about patients like Johnny, and how his life and family could be affected by a surgical site infection.